My name is Godinez, and I am going to inform you about premature births. Pregnancies are a time for enjoyment for the expectant parents and their families. But for others, the journey of pregnancy ends too soon. Premature birth is when the baby is delivered before the 37th week of pregnancy. According to the American Pregnancy Association, premature labor occurs in about 12% of all pregnancies. This is 1 out of 8 pregnancies. There are possible risk factors, treatments, and symptoms for premature births. There is no certain cause for premature births, but there are some major risk factors that lead to premature births. Health conditions such as diabetes, high blood pressure, kidney stones, or infections such as urinary tract infections, also known as UTI, or infections with fevers that are more than 101 degrees during the pregnancy, are some of the risk factors that may lead to premature labor. A woman's lifestyle also plays an important role during the pregnancy. Women who have no prenatal care, smoking or drinking, and have high levels of stress are at huge risk for premature birth. Another risk factor is the maternal background of the mother. According to Medline Plus Online, the mother's age, such as teenagers under 16 and women over 35 and African American ethnicity, are more likely to give birth to premature babies. When premature births do occur, there are some symptoms that occur, but you may not be aware of what they are. For most women who are going to give birth to their first child, the symptoms are kind of hard to determine. Contracting more than 8 times each hour, which is a tightening sensation in the lower abdomen, which is compared to menstrual cramps, is the most common symptom. Dual back pains, which is an unbearable back pain, pelvic pressure or pain, diarrhea, spotting or bleeding, and unusual or sudden discharge of the vaginal, are also major symptoms that you are going into labor. In the event that the baby is delivered before the 37th week mark, there are some medical treatments that can help save the infant's life, but are not guaranteed. We live in the technology era where we now have more state-of-the-art machines that can help premature infants live, where just a few years ago premature infants were not so lucky. When the infant is delivered, they are taken to the neonatal intensive care unit, also known as the NICU. And there, the infants are placed in an incubator, which is a warmer that controls the air temperature. The infants are hooked up to a machine that monitors their breathing, heart rate, and oxygen level. Most infants who are born premature are not able to suck or swallow, so they have a small feeding tube which is placed through their nose or mouth to their stomach. Ventilators are also placed on infants to help them breathe. The infant's health condition determines how long they will continue to receive medical treatment. Unfortunately, with all the technology we have, premature infants still do not survive. There are many more risk factors, symptoms, and treatments for premature births that medical professionals are continuing to research today. Although there is not a cure for premature births, the fight still continues today with fundraisers such as the March of Dimes, the Ronald McDonald House Charity, and many other local charities.